Hey guys, it's lockdown 2 day 19 and we just have one more week and next Friday I calculated so and it's the day 14 of the stay at home or the extension. Don't forget that, because don't forget it's being extended to yeah. So we have are reporting high cases today. We're back to the 4,000s with 4,212 extremely high cases again. So 1,249 really high cases are from Toronto. 771 is from high cases from Durham Region. 386 from Niagara Region. Hamilton's back on the list with 276, 214 from Durham Region, and 201 from Niagara Region. So Niagara Region is also back on the list again. So all other regions are reported under 200 cases. 32 deaths have been reported. Variant cases is now at 41,395, which is 2,119. And 108 South African variants, which is a +3, and 211 Brazilian variants, which is a +1. And apparently it's been reported that Doug Ford is quarantining himself right now because after a government member got tested positive for coronavirus. So yeah, after being in close contact with a staff member in this office who was tested positive for coronavirus. So according to the statement, Doug Ford was in contact with the affected staff member on Monday. The staff member was tested on Tuesday after being told that he came in contact with, after that person came into contact who had coronavirus. So the employee got tested positive. And this is when people are using the hashtag "Where is Doug Ford" trends on Twitter. So Doug Ford, he got tested for coronavirus, and his results came out negative. So he's in the clear. But he will, of course, be following public health advice to quarantine himself and. And also, other staff members have also have had to go forced to quarantine themselves. So while he waits for Toronto Public Health to Unit 2. For further instructions, Doug Ford will keep working from home. So if you go on Twitter, that's going to be trending right now. You know, I'm surprised that they didn't do that for Joe Biden when he went silent in the USA. And Doug Ford is trying to get more vaccine to come in, because of course the Moderna Incorporated not being cooperative with us still, and we have a lower number. Still have a slight lower number of AstraZeneca vaccines, and the Johnson single shot vaccine is not available in Canada yet, apparently. So it's been approved but not available yet. So and on Sunday, the Ford's office announced that he was contacting international allies about another delay with Moderna, with a small sufficient amount of Moderna vaccines. So screws. Well, we know who to blame now. Moderna Incorporated. Don't forget, last month they gave us 3 out of 10. So like 30% of the original batch they were supposed to send us. So they were supposed to send 300,000 Moderna vaccines. They only sent 90,000. I did the math. And the results came out 30% of the actual amount they were supposed to send. So they did the same this month too. Don't forget that. They were supposed to send it in April 12th. Yeah, they're really like and also there's also an issue with the demand for critical care nurses in high demand in Ontario. Is a high in hospitals as a third wave puts pressures on hospitals. Let's focus on Humber River Hospital. So it's as reported, it's very quiet. There are no family members visiting. Many are either home in isolation, or they're sick with coronavirus themselves, or unable to come and see their loved ones. So outside each patient room sits a critical care nurse, almost like a security guard keeping watch. So the constant and the complex. A critical care nurse, named Laura Mailing is caring for the coronavirus patient who is in his 40s. He's on the maximum amount of settings on a ventilator that we can put him on, and 100% oxygen. He's also unstable with his blood pressure because of the other medications we're giving him. So he's quite young and extremely sick. So she said we give them sedation, and we have to manage their blood pressure, and giving them medications like that can only give here in the ICU. So that's when we need a specialized training to deal with all of that. So what many their critical care nurses are like this is the problem they're dealing with a lot, and the shifts are grueling, and the caseload can feel at times hopeless because despite the team's best efforts, even though they tried the best they can, some critical coronavirus patients will not, they will die sometimes only with only a nurse like Laura Mailing at their bedside. So Laura Mailing mentioned how she had to deal with a patient she was taking care of dying, and who was very young, in her 40s, and she passed away of coronavirus. So she said, we felt so helpless because we were doing everything we can, and it still wasn't enough to fight against this virus. So this automatically proves that the third wave of coronavirus is the worst out of the first wave or the second wave. So, and Nurse Laura said, there's been a lot of younger patients with the third wave. So in the initial wave, it seems like a lot of older communities were affected, and nurses and in the nursing homes. And this time, it's scary to see. You're seeing 20, 30, 40-year-olds incubated on ventilators with COVID. It's so scary to me. That's scary. Treating patients who are younger than me. So, yeah. So Laura Mailing, she is she's about to be on maternity leave. She is spent her pregnancy when working in the ICU caring for the severely ill. But the issue is we need more nurses to critical care nurses to cover like all these jobs. Like maybe someone's pregnant, maybe someone they had an accident or something like that. Like, and someone in that case someone needs to fill in their job. So a critical care nurse, Justin Moreno, he said it does require special knowledge, skill, and judgment to be able to care for these patients. So, yeah, it's not like just being a regular nurse. You have to So he started his ICU nursing career right when the pandemic began. And he said how it can be very heavy mentally, emotionally exhausting, having to witness multiple deaths, and to get to a point when it's really depressing because you don't really see the light at the end of the tunnel. So he has seen his colleagues experience burnout, and others who have just left. And then there have been nurses who have just quit because they couldn't take it, and it was too much for them. So, and also there have been changes of behavior in staffs, and so nurses. So there was. So ICU manager Raman Rai said each critically ill patient requires a 1-to-1 ICU nurse ratio. So she said, yeah. And she said that their unit has never had enough nurses with critical care expertise. Some didn't have So this is when things are going to get worse, worse. Which leads my focus today to so don't forget it, and the lockdown ends next week, next Friday. I calculated. Because I calculated and I was like, wait, 3 weeks? That doesn't make sense. So if you want to like go get vaccinated, go to www.ontario.ca/bookvaccine if you want to call them by to toll-free number if you want. It's 1-888-999-6488. So hospitalizations, that's my concern. So we have somewhat lower than usual. So it's at 2,335 people hospitalized with coronavirus, minus 25, but still dangerous. At 790 ICU patients, plus 17. Like the nurses, Nurse Laura Mailing has said it's going to be getting worse. And other other ICU nurses have saying things are getting worse. And 566 of these patients are using a ventilator, which is increased 29. So long-term care home deaths is at 3,755. Okay. And there's 34 outbreaks right now, so that's minus 2 from the last day it was mentioned. So this is when it gets really serious. So, and please remember, if you were crossing, I'll still share the rules for the requirements to cross the Ontario Manitoba border and the Ontario Quebec border, and Ontario Provincial Police and Quebec Police will also be patrolling at these borders, and also at Highway 401 Autoroute 20. Right near Bainesville. So this really proves so coronavirus cases have just really increased now, and a number of ICU, it's just getting even worse, and it's really serious for them right now. So let's just hope that the nurses they got and these patients have luck surviving, and they'll see the light at the end of the tunnel, because some won't make it, and we need more ICU critical care nurses more than ever, because it's not like when the first or second wave. It's more serious now, they say.